Here's some expert advice for anyone that is looking to get into a Medicare Advantage plan. And here are 10 reasons why I wouldn't advise for you to get into a Medicare Advantage plan unless you cannot get into a Medicare Supplement plan. Reason number one, a lot of agents promote Medicare Advantage plans simply because they get paid a lot more than the agents then sell Medicare Supplement plans. So that would be a wrong reason to promote the product. Reason number two being the wrong reason. I hear this one all the time. I am healthy and I don't go to the doctor much. I've heard that many times. Reason number three, I am not sick and I'm not planning to get sick. So why should I get a Medicare Supplement plan? Well, you may not be planning to get sick, but here are some of the things that happen to us once we get over 65. To some people, they may happen sooner, but here's a lot of reasons and a lot of things that happen to you after you turn 65. But as you get older, more of them will probably happen. Number one, diabetes. Very common problem among seniors over the age of 65. Number two, heart problems. Very common on people after the age of 65. Dementia. Arthritis. A lot of people don't realize how severe arthritis could be, like if they have rheumatoid arthritis, for example. Kidney disease. Very common on elderly people. COPD, which is a breathing disorder, very common, especially if you're a smoker. And finally, Alzheimer's, terrible disease, and cancer, which if you have a Medicare Advantage plan and you have cancer, you're going to end with a very large bill. But that is something that we can discuss at a later time, or you can watch in some of my earliest videos that I have. Another reason number four, would be low premium. But if you are listening to that reason that people give you, low premium, understand that low premium or zero premium doesn't mean that you're not going to spend any money, because the plan may be zero premium, but you will have lots of copays. Copays for doctors, hospitals, MRIs, CAT scans, chemotherapy, radiation therapy, and all sorts of tests, which are not free, even if the Medicare Advantage plan, it's a zero premium plan. Another one that I hear all the time is perks. People look at the perks that a Medicare Advantage plan has rather than looking at the medical coverage. And some of those perks could be things like dental, vision, hearing, and over-the-counter medicines. You just simply cannot select a plan based on perks, because that's all they are. They're perks, and a lot of insurance companies give you some very small perks to attract you to a Medicare Advantage plan. So your focus really should be the medical care, the cost of your medical care. If you need an MRI, or you need a CAT scan, or if you need a surgery, you need to be hospitalized. Those are the things that really should matter to you, and not the perks, the little money that they give you for over the counter and for a little bit of dental and a little bit of hearing, that most of them are really nothing but a teaser. Number six, one that I hear a lot, my neighbor or my friend or my relative has a free Medicare Advantage plan. So why should I pay for my Medicare Supplement plan? Well, I can tell you that if you have a supplement and your neighbor has a Medicare Advantage plan, without even looking at what Medicare Advantage plan your neighbor has, I can tell you that your plan, if you have a supplement, is superior and much, much better than any Medicare Advantage plan that your neighbor or anyone else could have. Well, you may want to ask your neighbor that recommended or told you that they have an Advantage plan if they really have to use it for any kind of serious illness or hospitalization, if they have to use them for a procedure such as an MRI or a CAT scan, or an in-hospital hospitalization that they have to stay for a period of time, or a surgery. Because if they did, one thing that your neighbor will agree with you is that they had a lot of copays, because all of those procedures, if you're in an Advantage plan, will have a dollar number associated with it for the procedures. For example, if you need a hospitalization and you have a Medicare Advantage plan, you may have to pay $300 or $400 per day while you're in the hospital. Or if you need radiation therapy, or if you need chemotherapy, you will have to pay 20% of the cost of the chemo and the radiation, which is not the case if you have a Medicare Supplement plan, which your cost of the radiation and your chemo will be paid between Medicare and your Medicare Supplement plan. So when somebody recommends you an Advantage plan because they say they're not paying anything, you may want to ask them what's the experience that they had based on copays, and you may want to ask even further if they have had any serious illnesses since they have the plan, because if they never had an illness, or if they haven't had any serious illness, they're going to say, well, our copays are very little, because they may have no copay just going to a regular doctor. But the question is, well, what will happen if you need to be hospitalized? What will happen if you need a surgery or an MRI or a CAT scan or whatever you get done? Well, the answer is, if any of those things happen to you, you need any of those procedures, you're going to be paying some very large copays if you go with a Medicare Advantage plan. Many people think that if they make a mistake and they select a Medicare Advantage plan, that they can switch back to a Medicare Supplement plan at any time that they want. And that is not true at all. And it's important that you understand that, yes, if you go into a Medicare Advantage plan, you may be able to switch back to a Medicare Supplement depending upon when you want to switch and for how long you have the Medicare Advantage plan. For example, if you had an Advantage plan and you had it for a period of time, over a year, then if you want to switch to a Medicare Supplement plan, number one, you will have to do it during the annual enrollment period, which is during October 15th through December 7th. But you will have to do a medical application with a medical questionnaire, which you may or may not pass, which means you may or may not get approved on a Medicare Supplement plan. So don't get fooled and think that you can switch at any time. First of all, you cannot switch at any time. It has to be done during certain times of the year that you can make those switches. And even if you can switch during that particular time of the year, you will have to go through medical underwriting, unless this is your first time that you're on a Medicare Advantage plan and you decided to try it for the first time, and you will have some time to try it during the first year. And if you didn't like it, you can switch back to a Medicare Supplement plan. But if that is not the case, if your health doesn't permit, you may not be able to switch back from an Advantage plan to a Medicare Supplement plan. Another thing that you may want to take into consideration, which is point number 8, that would be networks. On a Medicare Advantage plan, you will have networks. It doesn't matter if you go on a PPO or if you go on an HMO, you will have networks on either one of them. Now, on an HMO, you will not be able to get out of the network under any circumstance unless it's for an emergency reason to go into an emergency room. But other than that, you're stuck on that network if you're on an HMO. Now, on a PPO, you have a little bit more flexibility because you can get out of the network and you can go to a doctor that is outside of the network. However, the doctor has to be willing to accept your plan and the plan terms and conditions. If the doctor is not in the network and accepts the plan, and most likely you will be responsible to pay a higher copay every time you go to a doctor or a hospital that is outside of the network of your PPO plan. Number 9, Medicare Advantage plans have copays. Lots of copays and lots of limitations. So you definitely want to think about that. They also have, some of them, very high maximum out-of-pocket expense, which is the maximum amount that you're responsible to pay out of pocket during the year. Some of them have out-of-pocket expenses that you're responsible for of $6,000 a year, $7,000 a year, $9,500 a year. That's a lot of money that you will have to pay out of your own pocket if you end with a bunch of medical expenses during the year with your Medicare Advantage plan. And number 10, and one that drives me crazy, are the pre-authorizations that you need on a Medicare Advantage plan if you need to get procedures done, such as surgeries or MRIs or CAT scans, which will, these pre-authorizations will unnecessarily delay your procedures that you very much need. And a lot of times they will deny those procedures and they will deny those pre-authorizations, and your doctor has to continue applying and reapplying to get the procedure pre-authorized. Otherwise, you will not get it. If your doctor submits the procedure for pre-authorization, even if he thinks that you need a certain procedure done, the insurance company can deny that pre-authorization, and it will unnecessarily delay that procedure that you very much need. And finally, the only reason why somebody would need a Medicare Advantage plan will be if they simply cannot afford any premium from a Medicare Supplement plan. And some of the premiums from Medicare Supplement plans, if somebody selects a Plan N, for example, they're very low. We're talking about, in certain states, $75 a month, $90 a month. And understand this, if you cannot afford a premium of $70, $80, $90, $100 a month, you certainly cannot afford going into a Medicare Advantage plan that will make you pay thousands of dollars for procedures and thousands of dollars for hospitalizations that you don't have. So think about it. You can pay $0 for a Medicare Advantage plan and then be burdened with all these copays that you will have, which are very large. Or you can pay the premium for a Medicare Supplement plan, and then you don't have to worry about pre-authorizations. You don't have to worry about large copays. And the largest copay you have to worry if you go with a Medicare Supplement plan, if you would go with a Plan N, would be a $20 copay for a doctor visit and a $50 copay for an emergency room. But outside of that, you wouldn't have to worry about anything else at all. If you like the contents of this video, or if you need help for anything related to Medicare supplements or Medicare Advantage plans, you can call us and we will help you with that. If you enjoy the content, also please give me thumbs up and subscribe, and that will help me tremendously with my channel, and it will help us create additional content for you that you will be able to see, and it will help you educating you on Medicare supplements and Medicare Advantage plans. Thank you for your time and have a nice day.